Well, my friends, this is a case of a child aged about 3 years, has brought to me from the Midnapur district of Bengal. Lack of development, cognitive development, physical development, all become lack, tardy. The child, even in the age of 3 years, cannot hold up the head, cannot erect his head. The head falls down. So the child is very amiable in character, a laughing disposition, and the physical makeup as a whole is calcarea carbonica, fatty and flabby. So the disease is gliosis, development of the white matters of the brain. Development of the grey matter of the brain. So, in the central nervous system, a non-neoplastic reaction is known as gliosis. It can be caused by trauma, increased intraocular pressure, or some other factors too. It can also be induced by genetic disorders. So gliosis can cause, pathologically, the gliosis cause the brain scars. Brain ভিতরে দাগ ধরে দেয়, ফাটল ধরিয়ে দেয়, scars in the brain. Then what will happen? That impact the functions of the brain, the normal capability of the brain, the normal sensation of the brain, the normal organizing of the brain. So symptoms can be similar to brain tumors. The symptoms are similar to brain tumor, even though gliosis is not a brain tumor. Even though the gliosis is not a brain tumor, but the symptoms are similar to brain tumor, so this is known as gliosis, atrophy of white matters. So all these conditions are due to gliosis, but not brain tumor. So there is thinning of the parts of the brain, thinning of the corpus callosum, which connect the two cerebral hemispheres of the brain. So gliosis not only occur in brain, it can occur also in the spinal cord, also in the optic nerve. It can also in the optic nerve. So gliosis means damage, disturbed, dysfunctioning, disorganizing of the white matter, white cells of the brain. So gliosis is a frequent findings in the central nervous system in non-clinical subjects. Gliosis in the optic nerve is usually a reactive change associated with optic nerve degeneration. Optic nerve gliosis should be diagnosed and assigned a severity grade. However, that is not our object, our subject. Our subject is gliosis of the brain of this child. So there is lack of development, there is tardy development of gliosis. So gliosis due to central nervous system disorder, especially brain, so that is negative connotation. That means the negative side of cognitive development. Now, in allopathic, the treatment with antioxidants or removal of the molecules that contribute to oxidative stress has been able to reverse the process of gliosis in the hypothalamus of the brain. In homeopathy, we treat the patient symptomatically, constitutionally, the child having the physical makeup of calcarea carp. There is profuse salivation, urine frequent, profuse perspiration over the head, with the pillow far around, and there are sometimes epileptic convulsions aggravates during sleep, and the child cannot hold up the head, etc. So, considering the milestones growth, lack of development, considering the profuse perspiration over the head, considering the profuse salivation, etc., our prescription is Calcarea carbonica, and Calcarea carbonica is a great medicine for the child. Any kinds of child troubles, child disorders, child abnormalities, child diseases, Calcarea carb. It can safely be given to the child, so Calcarea carb is the choice of medicine for the child, and I do like to prescribe Calcarea carb in 50 millisiemens scale of potencies 1, 2, 3, 4 with the direction to be taken thrice in a day, morning, noon and evening. Let's see the result of the case gliosis. I shall share you the result, my friends, after 3 months.